All right, let's discuss this further now. That's the issue of COVID-19 as a whole, especially as it relates to Nigeria, and of course, the issue of stigma. I'm being joined on the program now via Skype by Dr. Ayodele Oluwole, who is a public health physician. Dr. Oluwole, thank you very much for joining us on the program.
Thank you for having me.
Yes, we know you're also involved in the training of the response team, especially here in Lagos. How is that going?
Yeah, that's going really well. There's been a lot of enthusiasm, a lot of volunteering that's going on, and then the state has put in machinery to provide adequate training for volunteers across all cadre, from doctors all the way to hygienists and cleaners in the States.
That's
yes,
quite
so
interesting. So people are actually volunteering?
Yes. A lot of people are volunteering, ready to go into battle, anytime.
Now, tell me, now we understand we're beginning to see community transmission. How dangerous is that?
Yes. Those are the places we really they want to go. I mean, we started by having a single case that was imported into the country, and then we gradually saw contacts of those of the index case, and then all other contacts that were imported, and further contacts of those. But as that graph began to fall, we are now seeing more of cases who apparently don't have any contacts, have any travel history, and have not had any significant contacts with persons who have had COVID-19. So community transmission is beginning to kick in, and then I think that we anticipated that this might be, the next level of how the virus is going to move, and then the state and the country, I think, is putting all machinery in place to make sure that that is duly combated.
Please, I want you to educate us more on this issue of community transmission. You just said it. You're a medical person now, and you just said, and that's, of course, what the NCDC has said. These are individuals. These are individuals, no travel history, no contact with a confirmed case. So how could they have contracted the disease?
Okay, yes, because of the peculiarity of this virus, of the SARS-CoV-2, we've seen that there could be transmission of the virus to persons without having symptoms themselves. So there could be asymptomatic transfer of this virus to other persons. So yes, we've not had history of contacts with somebody who has recently returned from places or countries where COVID-19 has been reported. Okay, but we also know that yes, there might be some undetected contacts. People have made travels. If you look at the GPS tracking of some of the contacts that eventually were followed up during contact tracing, you will find that so many people, because of human behavioral pattern of human beings, there's been a lot of movement, from state to state, and in the process, you could have possibly had transmission to other persons without necessarily having a direct link to them. Yes. So that might have been the reasons why we're now having a different state. You could see sporadic cases in different states, even though as Lagos State is the epicenter of the disease, but, people travel because of the epidemiologic pattern, of how people move in terms of transport, movement, trade, and all that.
I think I get your point perfectly. Say, for instance, if I was infected and, I just move around, say around Ikeja area, take a bus and all of that, there's a chance that other people on that bus or other people I meet on the way may get may catch it from me without these guys knowing. Okay. Now, how challenging do you think that would be, for